Good morning, everybody. This is Dr. Murali Bharadwaj, your 5-minute NEETPG preparation study mate. To become a topper in the entrance, you don't need big coaching programs or plan A's or plan B's. What you require is a good classmate, study mate. That is what Dr. Murali Bharadwaj is all about. In 5 minutes, I will give you a quick brush of 5 important topics, common clinical vignettes in the tomorrow's NEETPG, INI, FMG, etc., etc. Please join the WhatsApp study group. Every day, hundreds of MCQs we discuss in the WhatsApp study group freely. Now, babesiosis, hemolytic anemia, splenomegaly, tick-borne diseases, and PCR. These are our focus topics in this 5-minute review. So what you are seeing here you are seeing the microscopic picture where the gene-sustained blood smear shows round and amoeboid trophozoites without hemojoin. That is a classical feature. All of you know, Plasmodium is one intra-erythrocytic parasite. The only other intra-erythrocytic inside the RBC parasite is the Babesia microti. So 45-year-old woman, 3-week history of gradual onset of fatigue, malaise, and fever, chills, sweats, headache, and myalgias, very important. Recently, she So sorry for the interruption. A 45-year-old woman presents with 3-week history of gradual onset of fatigue, malaise, and fever. She reports chills, sweats, headache, and myalgias. So what do you see here? You can see intra-erythrocytic amoeboid and round form of the Babesia microti. She also has mild splenomegaly, anemia, thrombocytopenia. So the diagnosis is babesiosis. So tick exposure, fever, anemia, and characteristic blood smear findings. These are the things that you need to recognize. A 32-year-old presents with fatigue, jaundice, dark urines. So all this malaria, falciparum malaria, etc., they all present with hemolysis leading to intravascular hemolysis leading to the jaundice, dark urine, fatigue. There is a gradual onset of malaise. There is anemia, elevated LDH, low haptoglobin, hemoglobinuria, and the gene-sustained smear is showing Maltese cross. These are the tetrads, which are typically seen, which is very, very characteristic of the G6PD deficiency associated hemolytic anemia. So once there is any G6PD deficiency, any intimidating drug which can cause oxidative stress or any infection like babesiosis. It is a stress, oxidative stress, that will precipitate the development of hemolytic anemia is what you need to recognize. Then a clinical VNet on splenomegaly. 28-year-old, history of fever, chills, sweats. She has a fever of 101.3, splenomegaly, thrombocytopenia, anemia, and elevated liver enzymes. But gene sustain is negative for parasites. So any combination of fever, splenomegaly, negative blood smear for parasites, classical of infectious mononucleosis, which is commonly caused by the Epstein-Barr virus. Then a 45-year-old with fever, chills, headache, muscle pain, muscle aches. Muscle aches is very important clue. Anemia, thrombocytopenia, elevated liver enzymes. PCR testing is showing Babesia 18S ribosomal RNA is positive. So what is your diagnosis, doctor? Tick exposure classically is ehrlichiosis, which is tick-borne disease that can present very similar to babesiosis, but diagnosed with uh, serological tests, different serological tests. Coming to PCR, a 60-year-old immunocompromised man, headache, nausea, hepatomegaly, anemia, thrombocytopenia, blood smear is negative for parasite, but PCR shows Babesia DNA. So that's how babesiosis typically is made, detected by doing the PCR test is what you need to remember. So keep following. We keep posting 5-minute rapid NEETPG revision sessions.